I can report that today that we have had 26 new cases of COVID-19, bringing our state total to 231. In addition to that, we now have 23 people who have recovered. Of the 231, 10 are still to be contacted and interviewed. So obviously our contact tracing team is in the process of doing that. 17 are males and 9 are female, ranging from the ages of 7 through to 81. So there's just the one child, and I understand that child is self-isolating at home with their family and is comfortable. Now of these cases, one adult is from regional WA, that case is from Pilbara, and of the total cases across regional Western Australia now, we have 1 Goldfields, 2 Midwest, 6 Southwest, 3 in the Kimberley, 2 in the Wheatbelt, 2 in the Great Southern, and 2 in the Pilbara. There are 11 COVID patients in Perth hospitals and 3 are in a critical condition. Today I want to make an important point. In Western Australia, every case up to last night, that is all the 205 cases, have been connected in some way to overseas travel. 50% of those people were people who have returned to Western Australia on flights. 25, as we mentioned yesterday, 25% are cruise ship passengers and 25 are close contacts with either those cruise ship passengers or people who have returned from flights. So obviously that is a really strong situation for Western Australia to be in. 2 are listed on our daily snapshot as unknown source, and I just wanted to clarify what we mean by unknown source. Now, in relation to that, these aren't people who necessarily contracted the virus from community spread. In these particular cases, all these were close contacts with overseas travellers. Now, by the time the overseas travellers were tested, they were negative. So potentially these 2 from unknown sources caught it from those travellers as they are recovering from their illness, but not before they had the opportunity to pass it on. Today we're also distributing a graph which has been circulated by the Commonwealth. This graph provides you with details of the Western Australians against the other state and territories and our sources of transmission. It shows that the vast majority of our cases have come from overseas, with a small percentage acquired through contact with confirmed case. As I said, 25%. And as I mentioned earlier, all these cases had contact with an overseas traveller. So we have the smallest number of cases across Australia that are still under contact tracing activities. We do not have any unknown cases, which as you can see, other jurisdictions are currently struggling with. So I provide this information to just simply to make sure that people are aware. We understand where the problems are that we're experiencing at the moment. We understand the contacts, and our contact tracing team is doing an outstanding job of making sure that we can trace down everyone that are close contacts with these travellers or positive cases, and ensuring that we get the information that we need so that we can isolate those people as well. Now, just moving on to cruise ships. From today's new cases, 4 are passengers from cruise ships. 1 from the Ruby Princess, 1 from the Sun Princess, and 2 from the Voyager of the Seas. This means that we now have 51 cases in WA directly from cruise ship passengers. On top of this, 4 positive cases in Western Australia have so far been directly related to close contacts with a cruise ship passenger. So we can see 55 cases are now related to cruise ships, and there could be and probably will be more. But this emphasises the major problem that cruise ships have represented in terms of making sure that we manage the spread of the COVID-19 virus. We are still in a very enviable position. Now, with regard to the Artania cruise ship currently anchored off Fremantle, I can report now that 1 man in his 70s has been transferred off the vessel. He had a life-threatening condition, and his illness however, is unrelated to COVID-19. He is not one of the 7 passengers who tested positive for coronavirus. However, as a precaution, he is being treated in a negative pressure room at Fiona Stanley Hospital to ensure that we don't take any unnecessary chances. But I'd like to reiterate the message from the Premier. It remains our preference for all COVID-19 cases to be taken. It remains our preference for all COVID-19 cases to be taken off the ship. They should be taken to a Commonwealth facility, that is a military base, and the ship should then sail on to South Africa. If any of those cases become critical, we stand ready to assist those particular passengers. A couple of other announcements just in relation to today. From today, we are also announcing new regulations to ensure easier access to some prescription medicines. This provides special authority to allow pharmacists in Western Australia to supply ongoing prescription medicines during the COVID-19 health state of emergency to make it easier for people who need ongoing medications. It applies to patients already under treatment with a medicine where their prescriptions have run out and it is not possible for them to get to a doctor to obtain a new prescription. Under these circumstances, if a pharmacist is satisfied that treatment is urgently needed, they may dispense with a standard 1-month quantity of the medicines. Also just want to announce today that we are making $3 million immediately available to funding institutes and researchers to support the COVID-19 related research. This funding scheme will enable WA researchers an opportunity to be part of a global effort that's ongoing at the moment in relation to minimising the impacts of COVID-19. And obviously you can imagine that this goes down to understanding the pathology, understanding how it's spread through the community, looking for those biomarkers that we need to make sure that we have other ways that we can identify the disease. And we've got some, as you know, internationally renowned researchers in Western Australia, so we're very much looking forward to making sure that they can assist in providing more insights into the disease. Look, this is difficult times, but we're all in this together, and together we'll get through it. We need people to continue to practice good physical distancing, making sure that they're self-isolating if they become ill, if they're a confirmed case or a close contact of a confirmed case. But we need everyone to participate in this campaign. By practicing good physical distancing, we will be able to slow the spread of this disease in our community, and we will make sure that it doesn't overwhelm our health system and cause unnecessary deaths. Thank you very much. Any questions?